Hello everyone, my name is Ankur and welcome to RJPT Simlab simulation. In this video, we will study about the different routes of drug administration in rats and mice. Let's start with the video. As we can see, the major route of drug administration in rats and mice constitutes of the parenteral route and the oral route, and it contains the other subdivisions under which the drugs are administered. Now let's start with the parenteral route. In the parenteral route, it constitutes the first, the subcutaneous route, the second, the intraperitoneal route, the third, the intravenous route, the fourth, the intramuscular route, and the fifth, retro-orbital route. Now, let's start with the first parenteral route, which is the subcutaneous route. The subcutaneous route consists of the layers of the skin, which means we have to insert the drug between the layers of the skin with the help of the syringe and the needle. As we can see, this is our syringe loaded with the drug, and we are inserting it with the needle between the layers of the skin of the rat. We have to, for this method, we have to gently hold the rat and elevate the skin. As we can see, we have elevated this layer of the skin so that the needle does not damage an internal organ and directly goes inside the layers of the skin. The description of this route says that injecting the drugs under the skin, usually in the back of the neck, suitable for small volumes and suspensions. This statement says that we are injecting the drug under the skin, which means that between the layers of the skin. As we can see, this is a needle which goes between the layers of the skin, and we usually provide the subcutaneous route on the back of the neck. As we can see, this is the back portion of the neck. This route is suitable for small volumes of drugs and usually suspension formulation. Now, let's move on to our second method, which is the intraperitoneal injection route. For this route, we have to hold the rat very carefully so that it immobilizes and does not disrupt and discomfort during the procedure. As we can see, this is the intraperitoneal region of the rat. It is nearly the abdominal region, and this is the drug loaded syringe with the needle. We have to insert the needle into the intraperitoneal region. The description of this route says that commonly used in rats and mice. Rapid absorption due to large particle size surface. Mouse doses may be smaller than rats doses, typically ranges from 2 to 10 milliliter per kg. The statement says that this route of administration and method is usually used in the rats and mice. And in this, we can observe rapid absorption of the drug because we are directly inserting the drug into the peritoneal region, into the abdominal cavity, where the absorption of the drugs takes place. The dose of the mouse and the rat differs. The mouse dose may be smaller than the rat's doses, typically ranges from 2 to 10 milliliter per kilogram. Now let's move on to our third method, which is the intravenous injection route. For this method, we need this instrument, which is known as the tubular mouse holder. We have to carefully insert the rat inside the tubular rat holder, and we have to close the lid, and we have to observe and we have to maintain that the tail of the rat is outside of the tube so that we can insert the drug via the tail vein of the rat. As we can see here, we're gently closing the lid of the tube, and the red rat tail of the rat is outside of the tube. As we can see, this is the injection loaded with the drug, and it is connected to a needle. And the needle goes directly inside to the tail vein for the insertion of the drug. The description of this route says that it is a very common method. IV injections are mostly commonly administered via the tail vein in rodents, which means in the rodents we use the tail vein for the insertion of the drug. The lateral caudal vein. The lateral tail vein, located on either side of the tail, is often used for IV injections. In rodents, we use the tail vein, which is also known as lateral caudal vein or lateral tail vein. We can insert the drug on either side of the tail, either on the top or either in the bottom side of the tail. The scientific justification for this method that IV administration provides rapid and direct access to the bloodstream, allowing precise dosing. The statement says that the IV administration of the drug provides the rapid onset of action, and direct access to the bloodstream. We are directly inserting the drug into the bloodstream, and due to that, rapid onset of action of the drugs takes place and allows a precise dosing. Why does the IV route gives a faster onset of action or a rapid onset of action because it bypasses the first pass metabolism which is performed inside the liver. The application of this method. First is the research studies. The IV injections are essential for pharmacokinetic studies, drug efficacy evaluations, and toxicology assessments. Then, for the experimental models, they are used in disease models, drug delivery studies, and for therapeutic interventions. The needle size for this method should be of 27 to 30 gauge needle is suitable for tailwind injection. We have to use a needle of 27 to 30 gauge. The volume of drug that should be inserted into the vein is for mice. IV injections involve small volumes, usually zero point 0.2 ml. Alternatives of this method are the retro-orbital injections through the eye are also used for IV delivery, IV drug delivery. The alternative for this method is the retro-orbital. We insert the needle into the retro-orbital region, and this that is the alternative of this method. Now let's move on to our fourth method, which is the intramuscular injection. In the intramuscular injection, we insert the drug-loaded syringe and the needle into the muscular region of the rat. As we can see, we are inserting the needle into the thigh muscles of the rat, which is a very muscular part of the rat. This is our syringe loaded with the drug, and we are inserting the needle into the thigh muscle of this rat, which is a very muscular part. We have to gently hold the rat, and for this purpose, we have to keep the rat under anesthesia so that it does not interrupts and disrupts the procedure. The procedure says that the IM injections are administered into the thigh muscles of the hind limbs. As we can see, these are the hind limbs, and we are inserting the needle into the thigh muscle. Caution. Care must be taken to avoid injury to the static nerve, which is located in close proximity to the femur. This is a very important part which says that we have to avoid the static nerve which is present in the thigh region or the femur region. We have to avoid that static nerve so that if we touch the static nerve, it will get injured and it can give static shock to the rat, and due to which the rat can immediately die. The considerations. The first is the muscle mass. IM injections are not generally recommended in mice or rats due to their small muscle masses. This is a very important point which says that we does not provide this method for the insertion of drugs into the rats or mice because they are very small and they contain the small muscle parts. The scientific justification says that, however, if scientifically justified in the Institutional Animal Care and Use Committee Protocol, IACUC protocol, IM injections can be used. The IACUC protocol says that we can use the intramuscular method of drug administration in rats and mice because these are scientifically justified by the IACUC. Then anesthesia. Brief anesthesia, for example, we can use isoflurane is normally required for immobilization and proper placement during IM injections. We have to keep the rat under brief anesthesia so that it does not immobilize and disrupts the procedure. Now let's move on to our fifth method, which is the retroorbital injection route. For this route, we have to insert the needle inside the retroorbital sinus region of the rat. As we can see, this is the retroorbital sinus region, which is located behind the eye. We are inserting the needle. This is a needle portion which is inserted into the retroorbital sinus region. The purpose of this route is that the retroorbital injections are an accepted intravenous route for administering certain compounds and initiating parasitic infections in rodents. The statement says that this is an accepted IV route for administering drugs and certain compounds, and through this method we can initiate and insert parasitic infections in the rodents. We can introduce these infections. Technique. Proper training is essential for both the injection method and the general anesthesia. The statement says that we have to perform, this method should be performed by a well trained person who knows and has the knowledge and has the well training for this route insertion of the needle and to provide general anesthesia. The procedure of this route is the firstly the anesthesia. The retroorbital injection should be performed under general anesthesia. We have to keep the rodent under the anesthetic effect so that it does not move or interrupts. Second is the indication. You have to use retroorbital injections when other blood sampling techniques, example peripheral veins, are not feasible. We have to use this method of drug administration in rats and mice when the other peripheral veins are not visible or are very delicate and soft. The injection site. The injection site is behind the eye, the retroorbital sinus. As we can see, this is the eyeball, and the retroorbital sinus region is behind the eye. The volume. Administer up to 1% of the animal's body weight per injection with a maximum injectable volume of less than 200 microliter in adults and in and 10 microliter in neonates. For adults, we have to maximum dose is less than 200 microliter, and for neonates or newborns, we have to use 10 microliter. Frequency. Limit retroorbital procedures to one injection or sample collection per day per mouse. This is a very important point which says that we have to reduce the use of this method once for a single animal or for a single eye. We have to, for alternatives, we can use the other eye, and we have to give a gap for the same rabbit to perform this procedure. The alternating eyes. If multiple retroorbital procedures are necessary, alternate between eyes and allow 1 to 2 days between procedures on the same eye. We have to provide them gap of at least 1 to 2 days so the rodent does not feel pain and gets comfortable with the situation. Caution, do not exceed 2 injections per eye in a mouse. We do not have to insert more than 2 injections per eye in a mouse or 2 times in the same eye in a single mouse. Now, let's move on to the second route of drug administration, which is the oral route. The oral route contains majorly two types. The first is the intragastric gauge, and second is the through buccal cavity. Now, let's see the first, the intragastric gavage. In this route, we have to provide the drug with the help of a gauge which is connected to a syringe inside the GIT of the rat. As we can see, this is the gauge which we are inserting inside the oral cavity to the GIT of the rat. This method should be performed very carefully so that, and we have to hold the rat very carefully so that it does not resist and disrupts the procedure, otherwise, it can choke on the gauge. The purpose of this method is that the oral gauge is used when a specific volume of an agent needs to be administered orally to rodents. The statement says that when we have to specifically administer the oral drugs, then we have to use this method. The technique is that a bulb-tipped gastric gauge needle or a flexible cannula tube is attached to a syringe. The compound is delivered directly into the stomach. This is a needle type, the bulb-tip gauge needle, and there is a second type, which is also known as flexible cannula tube, which is attached to the syringe. It is flexible so that it easily inserts inside the gastric tract, and the drug is directly delivered inside the stomach. Supplies needed for mice 18 to 20 gauge feeding tubes about 1.5 inches in length with a round bulb tip. Smaller tubes are used for young mice. And for rats, 16 to 18 gauge feeding tubes about 2 to 3 inches in length. Larger rats, 30 plus grams can be used, and 18 gauge rounded bulb tip gauge needle. The maximum dosage for the animals, for mouse, we have the maximum dosing volume is 10 milliliter per kilogram, and for rats, the maximum dosing volume is 10 to 20 milliliter per kilogram. And for pregnant animals, may have lower maximum amounts according to their situation and condition. Now let's move on to the second method, which is the through the buccal cavity route. In the buccal cavity route, we have to insert the drug into the buccal cavity, into the buccal mucosa, and the absorption of the drugs takes place in the buccal cavity. The description says that the buccal mucosa, which lines the oral cavity, offers an attractive route for systemic drug delivery in rats. The absorption of the drug takes place in the buccal cavity directly into the systemic circulation. The advantages of this route is that first is a non-invasive. Unlike invasive or parenteral route, buccal administration is non-invasive, which means this route is very safe and does not provide pain to the animal. It avoids first pass metabolism. Drugs administered via the buccal route directly enter the internal jugular vein, bypassing the liver and avoiding first pass metabolism. This is a very important statement which says that the drugs are directly administered through the buccal cavity into the systemic circulation and into the internal jugular vein, which bypasses the liver and avoids the first pass metabolism. Usually, the first pass metabolism mostly metabolizes the drug and degrades the half of the drug. So it avoids the first pass metabolism. That's why it provides a rapid and a 100% bioavailability of the drug. Challenges for this route. First is the mucosal barrier. The buccal mucosa represents a barrier to the drug penetration. The buccal mucosa, which is present on the lining of the buccal cavity, acts as a barrier to the drug penetration. Enzymes in saliva. Saliva contains enzymes that can degrade the drugs. It can metabolize directly into the buccal cavity and can degrade the drug. Discomfort and taste. Some rats may experience discomfort or dislike the taste of the drugs administered via this route. Yes, this can happen. It can discomfort or dislike the taste of the drugs which is administered via this route. Now we have studied all the different kinds of routes for the drug administration in rats and mice. Now let's do a quick recall over these routes that we have studied. The first is the oral administration. The description is that the oral administration involves delivering the drug directly into the animal's mouth, usually via gauze needle or feeding tube. The procedure is that first is the preparation, measure the required dose of the drug solution, then gently restrain the animal to prevent movement. We have to hold the animal very gently so that it does not move, and administration insert the gauze needle into the mouth, passing it down to the esophagus to the stomach, and slowly deliver the drug. We have to deliver the drug very slowly. The advantage of this method or this route is that it mimics the natural route of drug intake in humans, suitable for long term studies. The considerations are that it requires a skill to avoid injury to the animal and not suitable for drugs that are poorly absorbed or unstable in the GIT tract. The second is the intraperitoneal route. The description is that the intraperitoneal administration involves injecting the drug into the peritoneal cavity, the space within the abdomen that houses the intestine, liver, and other organs. We have to insert directly inside the peritoneal cavity with the help of a needle or syringe. The procedures are that first is the preparation. We have to prepare the drug solution and a sterile syringe with a fine needle. Then restraint. We have to position the animal on its back and gently restrain it. Then the injection is inserted into insert the needle into the lower right quadrant of the abdomen, avoiding the midline, and inject the drug. We have to avoid the midline and we have to insert into the right quadrant of the abdomen. The advantage of this route is that it allows for rapid absorption and is suitable for drugs that are irritating to the tissues. Then considerations, risk of injuring internal organs and proper technique is essential to avoid complications. This statement is very important because the risk of internal organs are getting injured is a major part, and we have to be very careful for this thing. The person with well trained should perform this procedure. The intravenous route. The intravenous route administration involves injecting the drug directly into the vein, providing immediate systemic circulation. This step In this step, we insert the drug directly into the bloodstream, at which involves the first pass metabolism. The procedures are we have to prepare the drug solution and sterile syringe with a fine needle. We have to restrain the animal and locate the suitable vein. We have to locate the tail vein in the rats and mice. Then injection. We have to insert the needle into the vein and slowly inject the drug. The advantage of this route is that it provides a rapid and complete bioavailability because we are inserting the drug directly into the bloodstream and avoiding first pass metabolism and is suitable for drugs that require precise dosing. The considerations for this route are that it requires skill to locate and access veins. Risk of phlebitis and other complications are also present. It requires a skilled person to locate the vein and who can access the vein and insert the needle in the vein. Next route. The next route is the subcutaneous route. The description is that the subcutaneous administration involves injecting the drug into the tissue layer between the skin and the muscle. We have to insert the needle between the layers of the skin, between the skin and the muscle. The procedure says that we have to prepare the drug solution and a sterile syringe with a fine needle. We have to restrain the animal and the lift fold of the skin. As we have seen in the video, we have to lift the skin so that the needle does not injure the internal organs and is directly inserted into the between the layers of the skin. Then injection. We have to insert the needle into the subcutaneous tissue and inject the drug. The advantage of this route is that it is suitable for slow release formulation, less invasion than intraperitoneal or intravenous route. Yes, this route is less invasive and less painful than the intraperitoneal route and intravenous route. And via this route, slow release of the formulation of the drug is seen as the drug has to penetrate between the layers of the skin and the muscles. So, due to this, it provides a slow release and sustained release. Consideration: slower absorption compared to IV and IP routes, risk of local iteration or infection. Now let's move on to the next route, which is the intramuscular route. The description says that the intramuscular administration involves injecting the drug directly into the muscle. We have to insert the drug directly between the muscles. As we have seen in the video, we insert the needle in the thigh portion, which is the very muscular portion. The preparation: prepare a drug solution and the sterile syringe with a fine needle. You have to gently restrain the animal and locate the suitable muscle, which is the thigh muscle. You have to avoid the static nerve so that it does not give static shock or injures the static nerve. The injection: insert the needle into the muscle and inject the drug. The advantage of this route is that it provides a relative rapid absorption and suitable for small volumes of the drug. It is rapidly absorbed and is suitable for small volumes of the drug. And then considerations: risk of the muscle damage and pain and limited to small volumes. We have to provide small volumes of the drug via this route, and risk of muscle damage and pain is also there. Then now let's come to the last route, which is the topical administration. The topical administration involves applying the drug directly to the skin or the mucous membrane. In this method, we have to apply the drug over the skin and to the topical part or the mucous membranes. The procedure for this method is that you have to prepare the drug formulation, example in the form of cream or gel, which will penetrate through the layers of the skin, and we have to apply it on topically. Then application: apply the drug to the targeted area of the skin or the mucous membrane. We can directly apply it to the targeted skin portion or the mucous membrane. And the advantage of this route is that it is non-invasive and suitable for localized treatment. It is a very important statement which says that it is non-invasive, which is it is painless. It is a painless method and it does not disturb or discomforts the animal and is suitable for local treatment. It provides local effect of the drug. Then the last is the consideration: limited to drugs that can be effectively absorbed through the skin and the risk of ingestion if the animal licks the treated area. This is a we have to be very careful with this, is that the drugs can not be effectively absorbed. Some drugs cannot be effectively absorbed. The drugs which have a high absorption only can be used via this method, via the topical region. And the risk of ingestion of the animals, if the animal lick that part where the drug is applied topically, then it will be washed off, it will be licked off from the target site, and it will be inserted inside the mouth of the rat and then to the gastric portion, which will degrade the drug. Now we have completed and we have discussed all our different drug administration routes in rats and mice. Now we have completed our experiment. I hope you liked this video and thank you guys for watching this video. And for more such learning content, subscribe to our YouTube channel and follow us on our LinkedIn profile, on Instagram and on Facebook. We post and updates our videos weekly over these platforms. Thank you.